welcome to Mums and Melanin. I'm Debbie.
I'm Takoni.
I'm Takumba.
I'm Ayola.
And today, guys, we got guests on the sofa.
Yes.
The TikTok extraordinaire, story time teller, aka Mama Dinya.
Hi guys. Hi.
She's been getting on, guys. Hey Elizabeth, how are you today?
I'm good, thank you. Thank you guys for having me.
Thank you for
I'm
being here.
I'm excited to be here, to be honest. Yeah.
So we're going to dive right into it. So we know you're a registered nurse and midwife.
Yes.
So we want to talk to you more about your midwifery, so to speak. How did you get into it? What made you want to become a midwife?
So I kind of always wanted to be a midwife. I always wanted to do something around women. That was my big thing, that I wanted to be with women. So I couldn't get into midwifery, so I went into nursing. That's
okay.
what. So I went into nursing, then I did nursing for about a year, and I still wasn't settled. I said, no, I have to do my thing. So I ended up specializing into midwifery, which made it much easier, and it made it only like a 1.5-year course for me to get into, because I was already a nurse. So that's how I got into midwifery. But why I wanted to be, I don't know. It's just always been, and true, like, because I'm a Christian, I remember praying, like, what should I do? What should I be in life? And like, what should I do? And I remember having a vivid dream of childbirth.
Really? At what age was this?
I think I was in year 12. I don't know how old you are.
Okay.
16.
Yeah. And I remember it being so vivid. I said, yeah, I might as well.
So when most people get into midwifery, they're more so like, I love children. I kind of just wanted to go down the route of seeing children be born, etc., etc. But you said you more so wanted to help women.
Yeah. So midwifery actually means with women.
Yeah.
That's the transition.
Yeah.
That's the translation of it.
Yeah.
Is with women. So if you like kids, you're better off going into pediatrics.
Yeah.
If you like women, you should go into maternity, because midwives will only be with you. They'll be with you the whole pregnancy and max a month after your birth. So I've been with you 9 months. I'm only getting 1 month with you max, and that's even if there's extra like safeguarding concerns or things like that. So I work in labour wards, so I see babies all the time, but I see them for max an hour. Whereas I would have been a woman 12 hours on the shift. So it's not, midwifery is not for people that love babies, it's for people that love women.
That's so
interesting. Very interesting.
What's your most I don't know, difficult encounter? And then I want to know. And then I want to know what your most easy and most joyful encounter is as well.
Difficult in what sense? In the birth?
Just everything.
Some of you felt was challenging.
What would you difficulties? There's sometimes being like a woman might be very different to what I've had, or the birth might be very difficult. But I'll tell you about my most difficult birth and the birth that made me learn a lot. So I remember I was a student then, and I had this lady, and she wanted a water birth, and it was my first water birth, and I was so excited. I was like, I can't wait. And then there was a language barrier. And that's always a big thing when there's a language barrier. There was a language barrier, and sometimes what I do is, if the woman doesn't speak my language, I quickly research what push means, what stop means.
Okay.
You know, because it needs to be quick. So all I knew was push and stop. So I remember she was in the water, and sometimes it gets a bit messy when women are distressed. And what had happened was, her heart rate was so high. A baby's heart rate is really high. Mummy's should be quite low. Her heart rate was so high that it was easy to be mistaken to be the baby.
Wow,
So by the time the baby came out, baby was in the poorest condition I've ever. I remember bringing out the baby. I said, "Now you need to go back inside. You need to go back inside and come back when you behave yourself." I remember just bringing out the baby and just panicking. And I was a student, and then I just didn't even. I was just in shock. So I remember having to cut the cord quickly, because a water birth is meant to be relaxed. Let the baby come out, let the baby swim. It was none of that. It was like cut the cord quickly, run to resuscitate, all that kind of stuff. So that was my most difficult birth, and it's traumatic because I've been a midwife for a little while now, and I was a student then, and that's still what I do. And my hospital, you do risk assessment. So when things like that happen, we have to have a whole meeting, what went right, what went wrong, and it's just a learning experience. But that was my most difficult birth, because the baby was in poor condition. But I stayed up on them, baby's fine.
Oh, brilliant. That's what I was going to ask, man.
Baby's fine. And my easiest one, I don't know,
most joyful experience.
My most joyful one. I remember this lady, we're still friends now.
Oh, really?
We're still friends now. I remember I I actually booked her pregnancy. I didn't, you know, when you do the first appointment when that long talk. So I booked her pregnancy, and she was a young girl with her boyfriend. You know, sort of was like a new experience. Like, oh my gosh, we're having a baby. And I remember saying, no, you're good, because she was black, and you know, I was able to vibe. So later on, I was in birth center when she came in, and I was like, oh my gosh, I know her. So I went to her, and I remember the birth was just so beautiful. She was so strong, and she just like, it was just so good. And I remember her partner being one of the most supportive men I've ever seen in a labour room. He was proper in there, like, he was like, no, babe, you got this. And I was like, okay, like, because normally men don't put their heads in. I said, can you step back? Just let me see, like, let me see what's going on. But that was my most, you know, she delivered a boy, and I went to his birthday. He was one. So we kept in touch, and she's my babes. Yeah, that's my most.
Do you come across that a lot, where you might follow up in terms of after birth?
No, that's why I remember her so well. I think for me, you can't get attached to everyone.
Yeah,
like every shift, like my last shift, I think I helped deliver like 2 or 3 babies. Imagine that every day and keeping in touch with every single one. It's difficult. So no, I don't really. I try to give them the best I can, and I always like to make a woman feel like you're the only woman I've ever looked after.
That's lovely.
You know, but in my mind, I've forgotten about that at lunch. And that's the truth. But it depends on, as long as you're happy. Because since social media, I've had a few mums like DM me, like, oh my gosh, I don't know if you remember, you delivered my baby in this year. And in my head, I'm like, I don't remember who I delivered yesterday. But I'm happy that I gave you a good experience. But no, I don't really keep in touch. No, unfortunately. But yeah.
Wow. That's lovely. I'm just thinking, in terms of birthing as well, do you have circumstances where the mum is a bit difficult to deal with? How do you deal with that?
I wouldn't say difficult to deal with, because you know what is pain makes everyone so different. So I say to myself, this is not the real you. Because more times after, they're like, I'm so sorry. So you get... so I do have births where sometimes you really do have to take yourself outside of the room and be like, Liz, let it go. It's calm. She's in pain. Because I'm a human being too. So sometimes when people say some things, I'm like, we're not going to do that. So no, I do have times, but I just have to always remind myself that they're in pain. And when I'm in pain, I'm not a nice person. But what I try to do for my mums is, if I can catch them in time, we talk about options, pain relief. You don't have to get to, we don't have to if you don't want to. We don't have to do that. Well, in 2022, we don't have to do that. So for me, I try to, if I can catch them, if I can only hear them scream from the lift, like I but if I can catch them, there's ways of, discussing pain relief.
That was going to lead me to my next question. What do you advise? So when you go in there and you see that she's still calm, she just got there, she's still in the happy, smiley, playing my gospel music, what do you say to her then?
We have a ladder, so we have pain relief we go up on.
Okay.
And I used to always want to get a woman to like her limit before offering her, but I find it's quite a hindrance, because when the pain hits sometimes, it's so hard to get them back to a calm state. So I've learned to sort of know if you have a calm woman that's not, that the contraction comes and she's like, and I know that that's someone doing well. Then suddenly she's like, I'm gonna stop. I know that it's starting to hit her. So I kind of ask them, what do they want? You should have written your birth plan. I know women are saying, no, I don't want epidural. That
was me. Until they gave it to me.
Exactly. So I just offer whatever I feel like the woman needs. Every woman is different. Every single woman. I never ever judge what this woman can do to what this woman can do. And when they come into my room, I'm like, listen, whatever you wrote before is what you wrote before. Now you're feeling it. You tell me what you want to do. I've had women that I would suggest epidural, but they don't want, so I support you in that. I have women that I know they could do without an epidural, but they want an epidural. I support you in that. Because it's not me. I can't feel your pain for you. So the best I can do is help you get rid of that pain if you want.
What are your thoughts on epidurals?
So my thoughts on epidural are, These are my notes. I have to make it clear now. This is my opinion. This isn't the NHS. This isn't a representative of where I work. I have to say all of these things.
Give me a disclaimer.
I think it's an option that's not, you can have it, but I think nowadays women don't trust that sometimes you can actually go without. And people, do you guys know, like after epidural, what the next pain relief is?
No.
Pethidine.
It's water.
What?
It's water.
How do
After
you
epidural, it's water, then pethidine.
Are you joking?
I don't understand.
How
I'm
do they
not-
administer
Water. You're like drinking water. They didn't tell me about that.
No. It's been in water, and people don't even want to know. They don't even want to hear because I'm like, oh, do you want to try the water? It really, really, really helps. And it's because with epidural, after an epidural, you have to have a catheter in, and you can't eat straight away, you can't walk straight away, and stuff like that. So for that reason alone. But sometimes there's different things. If somebody's been induced, that's a different kind of pain. That's a different kind. That's a man-made contraction. That's not what your body was going to do for you. So take your epidural. If you're being induced and you need it, take it. If you're not even being induced and you can't take the pain, take it.
That makes sense, I didn't realise.
Because funny enough, like when I was being induced, I was on the drip thing, and they kept begging me to take epidural, and I didn't want it. But now you're saying this, it makes sense to why they were kind of encouraging, because like you say, it's a man-made, and my body being forced to go into to contract more and all the rest of it.
You know,
But
like,
things like that.
for your body, it will gradually get more and more and more. But I'm literally pressing a button to tell you how much I want to give you. That's not your body. So you can't expect your body to have natural reflexes like to help that pain when I'm mechanically giving you that pain. So before I start that drip, would you like epidural? Because I know that this is not what your body is doing for you. So sometimes if I feel like the head is there or she's very close and she wants epidural, I'll find ways like, oh yeah, this is really good. But that's if I know the head is there.
What do they call the people that administer it?
Anaesthetists.
You've been looking for these people.
No, sometimes they actually come in. But I know what I need to do sometimes, because I know the head is there. And I know that in 10 minutes,
It'll be over.
Pushing,
I know, I'm like, literally, no, I need epidural. Okay, it's coming.
I suppose it keeps them calm as well, isn't it? Because you don't want to say you don't need it when someone's asking for it.
That's true.
So it's wisdom in the same breath.
How do you deal with those conversations where this mother needs pain relief, but they don't want it? Because a lot of people I've met, they don't want pain relief like in the first instance.
I don't know why though. I don't know why it makes women feel less of a woman. Or you've carried a whole baby for 9 months. You're a G. You're good. You're good. So I don't know why women feel like that. It's sad. I think there's a stigma that we really need to work on. And especially with black women as well. Like that I'm a strong black.
Don't scream.
Soft life.
Natural birth.
So what was this? So when I think that they need epidural, I remember I had a lady, a young girl. She was adamant she didn't need epidural. I knew
What she needs.
she would need because she came for induction. We haven't started the drip, and she was
All over the...
screaming. At one point I said, be careful, you're gonna fall. And she's like, I don't want to picture. I said, baby, please. She's the only woman that begged. Wow. She was like, no, I don't feel like I'm... And I remember she was like, I want to talk to my mom. And normally this time you don't even have more than like a certain amount of birth partner. I said, call your mom, I'll sneak her in. Let her speak to you. That it doesn't mean, an epidural does not mean you failed. It doesn't mean you failed. You're still pushing. Even if you go for a cesarean, it doesn't mean you failed. Even if you have an instrumental delivery, it doesn't mean you failed. It means you want the best for your baby, and whatever you need at that time for the best of you and your baby, do what you need to do. I'm big on that, man.
It's freeing though, isn't it?
I think there's a lot of cultural restrictions
stigmas as
around it. So you're obviously saying like there's nothing wrong with C-section and all the rest of it, but you know, there's this terminology that people have used in the past of, did you have your baby naturally?
Yes. Yeah.
But it's like, just because I had a C-section doesn't make it natural. Maybe not vaginally, but it's not natural.
Yeah.
So it's interesting that you're saying this.
I think there's a stigma in everything. Just choose your own stigma. Because if you're not pregnant, there's a stigma.
Yeah.
If you miscarry, there's a stigma.
Yeah.
If you have a baby vaginally but you didn't recover quickly, there's a stigma.
Yeah.
If you have a cesarean, there's a stigma. If you have an instrumental delivery, there's a stigma. Someone somewhere finds whatever you're doing wrong. So the best thing you can do for yourself is do what makes you happy. You do what you can cope with.
Yeah.
You know what I mean? If you didn't go for the cesarean and someone didn't go for the cesarean and that baby died, there's a stigma.
Yeah. It's true.
You know, they're not people that are looking at you and say, oh, you're less of a person because you had a cesarean, aren't the people that had to feed and look after a baby with a scar, with a wound, and something like you're literally holding your belly, you're holding your baby. You can't laugh, you can't, God forbid you're constipated. You know, all those kind of small things. So choose your stigma. Choose, because there's a stigma for everything.
It's true.
It's associated with everything.
Literally.
It's true. It's very
Choose
true.
one.
Wow.
You know, there's some midwives, you know, the aunties, the ones that will, the ones that will tell you, why are you laughing like this? The ones that, like, you know the ones I'm talking about, Okay, cool.
I got you.
Do you work amongst them? Like, is this something that you see at work? And
what's your opinion on it?
Yeah, what's your opinion on it? That's the next thing.
Thank God, my hospital, if I must say so myself, has amazing midwives.
Wow, that's amazing.
Like, I have options for when I get pregnant.
Wow.
Like, I could have you. You know, as in, but I do know what you're talking about with the aunties. And I remember at one point, I just was so sad because I said to myself, because I try my best for my women, innit? And I just think to myself, what about the days I'm not on shift? You know, what about that? You know what I mean? But I get with the aunties thing, and I get with the push now, push, start screaming, and it's just never helpful in a labor room. But I do know what you mean, and sometimes it just takes a kind. You know, it's depending on how you say things. It's the way they say things to the women, and it's the same way that I would say things to them because they're my seniors. You know, they've been in midwifery sometimes longer than I was even born. So there's ways of saying, oh, auntie, can we try? Literally with the
Would you say auntie? Wow.
The ones I respect. I say auntie. Like auntie or sister.
Yeah.
Like one sister, something, or sister. Like, we could do it like that. Or, you know, just little things that we can do and help. But midwifery is stressful, and I think some midwives don't know how to cope with that stress without inflicting it on the moms that they're looking after. Sadly, it happens.
Yeah. That makes sense.
So how long have you been a midwife for?
A year now. But with midwifery, when you learn midwifery, you're on the job as you learn.
You've been doing it for
So even like
years.
a month or 2 months in my studies, we had to be helping delivering babies.
What
So
was that like?
My first baby?
Yeah, like in your first few months.
So you know what? I banged out YouTube. And I was watching all the mums that I was just like, oh my God. Like, I used to watch it vividly. But my first ever one, that was a long labour. She was there for like 3 days.
Wow.
And I remember they were going to take her for instrumental. I said, oh, you're going to push this baby because I want to see. But I don't know, I enjoyed it. And I still feel that giddy feeling of, the baby's there, the baby's coming, the head is coming, you know, that kind of stuff. So I still feel like that because I'm still fairly like new to the whole
Do you get like an adrenaline rush like that when the baby's...
Yeah, especially when you... Like, I remember one time I was walking for lunch. I'm always going for lunch before all this stuff happens. I was going for lunch and I was walking past the reception and I just heard, when a woman's delivering, there's no more screaming like that.
Yeah.
So I was like, you know, I was eating my cheese and onion crisps. I said, no. So she's like, I was like, okay. I was like, bear with me.
In the canteen?
In the reception.
Oh,
wow.
And I remember like just grabbing a chair. By the time I looked down, the head was there. And I was just like, okay, we're just gonna, don't push.
Wow.
And you told them not to push.
I say, please, explain this don't push to me. Because I'm one of them ones that you tell me don't push. If my body tells me push, I'm gonna do it.
Yeah, you know. It's psychology. Because I can tell you not to push, but your body will tell
Yeah.
you. But the idea is that sometimes when you're not fully dilated and you push, it's a hindrance.
That's what
Your baby's head
happens.
can swell, your cervix can swell,
yeah.
it can cause more bleeding. So
can
you
rip.
have to be careful not to, you will rip. Yeah. So it's like, try not to push, but by the time the baby wants to come, especially when it's after the first baby, like a woman's had a baby already.
Yeah.
I've had babies in car parks, like I've had.
Wow.
Yeah, and I'm just like, congratulations. But yeah.
Wow.
You sound like a lovely midwife though. You sound
Honestly.
very friendly. Because you
Honestly.
do get some that almost don't. I mean, like you said, it's quite stressful, and some people don't know how to manage their stress, I suppose. And it is just a job. So my question is, whilst obviously we have a personal thing with our midwives, thinking you're delivering my baby, you should be giving me, you know, the best of the best. For some people, it's obviously I'm coming into work the
another
following day.
phase.
Because
Yeah.
it's another job, another patient, if you like.
It's, I don't know what to say to that because it's true. I see it. Sad. I don't even know what to do to, you know, I don't know what to do to appease that, like to make me feel better about that. Like, I don't know what to say because for some people it is just a job.
Yeah.
It's just a job for some people.
Yeah.
And I think I blame Boris. I think sometimes when people are understaffed, they're underpaid.
Yeah.
It's just a catalyst for
Yes.
for what you just said.
That makes sense.
But people, I feel like when you enter the job, I can't be like that. I can't be the same as somebody that works in retail. That, you know, maybe they just got angry because the person couldn't find their bag. It's different to someone's having a baby. It's a big thing.
Yeah.
You need a level of compassion. You know, like when you go
exactly.
to midwifery, it's not one of those jobs. You're not going into the office. You know
Yeah,
what I mean? Like,
exactly,
there's a level of compassion. That's why over time you realise that maybe it's a bit of burnout, just feeling exhausted, and you know, I don't know, losing that compassion that they have initially.
I had a moment like that. Sorry. I had a moment where I was feeling like not myself. And I remember a woman said something and it really irritated me. It irritated me so bad that I said to my manager that I'm going to come off work for 1 week because I can see that I'm not a good midwife.
Oh, wow.
She's so supportive. I said to her that if I stay for this week, I'm not going to give anyone good care. So I had to just step out because I said, the way what she said to me, someone could have said it to me later on when I was in a better mood, I wouldn't have bothered me. But there's also a time where you say to yourself that, you know what, me being here is a hindrance to you as a mum. So let me step out. So I stepped out, rejuvenated, blah, blah, blah. I came back, different mentality. It's important. But when you're so understaffed, people don't do that. It's true.
Yeah.
People can't do that.
Yeah.
When you're meant to have 13 midwives and you're only 6, how can you now say, oh, I think I would like, you know. Everyone will be like, you don't like anything, but I can't. But no, yeah.
With C-sections, would you say that there's a particular type of cage you'd get straight after? So some people are advised to sort of get moving as soon as possible. Some people have been advised to sort of lay for
6
a
weeks,
while.
heavy lifting.
No, even in the hospital, like,
Oh, is
in
it?
the hospital, like some people are told in their recovery room, if you like, to sort of just relax and kind of get the energy back up. Like you said, it's quite a lot. They've probably had, what's that numbing thing called again?
Oh, diastasis.
Yes, exactly. Anesthesia. So some people are asked. So what would you say is the best level? Because from my experience, I was told to kind of just, you know, relax and just get my energy up. I was laying down for 2 days. I didn't stand up. But by the time I stood up, I had to take morphine and all these things, and it was a bit of a panic that I hadn't because the pain was so much more. So is there a guideline around that? Is there a particular way, or is it sort of dependent on the person?
So it depends. Because with a cesarean, you can have an epidural, you can have a spinal. They're different kind of anesthetics. So it depends on, because I'm sure you had like a little tube to help with the urine because you couldn't stand.
Unfortunately.
A catheter, so you have that. But generally, when I was in postnatal ward, every woman is different. So we start with like wiggle your feet. If you can wiggle your feet like that, lift your legs. Can you lift your legs properly? Because what you don't want to do is lay in bed for 2 days because to recover, your muscles should always be moving. You know, you're used to like. So when you lay still for that period of time, they get a bit, you know, stiff, and there's an increased risk of blood clots. So you try to avoid that part. So for me, it's always like by the time we're taking out the catheter, we ideally, even if your first step or your first walk is with a midwife or with a midwifery assistant, try and do it within the day, within like 6 hours to 12 hours post-delivery. Even if it's you stand and you go back and you lie down.
Just something.
Just move.
Or do something. Just move.
Yeah.
Just move. But every woman is different.
Of course.
And I don't know, it's hard to say things like, this is the guideline. Every single one of our guidelines, there's always, you know,
some
buts.
But exceptions.
However,
depending on the scenario, of course.
I have a question. What do you hope to see for the future of midwifery?
Wow.
That's why I had to be like, I knew it was a good question.
for the hope of midwifery, I really hope. I hope women are cared for in its entirety. Like, I hope, because not what I care for, how I care for you can't be the way I care for you. You know what I mean? I hope midwives get to the point where they can acknowledge that women are different, births are different, and be able to care for that woman how she wants to be cared, what's best for her, in the best way for her to be cared. So that not everyone, don't get me wrong, not everybody can have a good experience. As in, there's always gonna be, but that I gave you my best, that I offered you everything I could offer, that I was knowledgeable, because you need to know your stuff. It's sad that you can come one day and your midwife is not competent. Like, that's crazy to me. That's crazy to me. So I'm forever reading policies, because like, as in like, it's a service. It's a service. So you come in and you expect the best. So I hope that my plan or whatever, my hope is just every midwife can give a woman woman-centered care. That particular, like, for talks, this is what I'm going to give you. Because I know for you, this is what's best for you. I know this is what I'm going to give you. You know? So that's my hope for me.
That's beautiful.
That's amazing.
That's so beautiful.
No, I wanted to ask, so, you know, like, studies have shown that black maternal health care is quite poor. Is this something that you've seen or witnessed, or how do you feel about it?
It's so sad. Like, it's so, I don't know if you guys know, they're 5 times.
Yes.
5 times more likely to pass away in
Childbirth.
childbirth. It's so sad. It's so sad because I don't know how to voice my sadness, but I think for me, just so that we can move on kind of thing, I want to tell black women that unfortunately, in this time, you don't have the luxury of coming into pregnancy and coming into labor clueless.
That's exactly
what we don't have that luxury. We don't have it. You don't have it. Unfortunately, you don't have it. So you have to know your stuff.
Exactly.
You have to research. You have to know what you want, because more times you're not going to get offered what you want. It's going to be, oh, this is what's best for you. But by the time you research things, you will know that, okay, you know what, let me try this. Actually, doctor, can I have this? Because what people don't realize is that, don't get me wrong, we'll always suggest to you what we think is best. But I don't have your body. You know what I mean? I can't tell you what to do. So I think for black women, it's so sad because it's just that stereotype of you're strong, and we've carried that so much that more times, like, black women don't even want to express their pain. They don't even want to express their pain. I had a lady the other day, and I was sad looking after her because she just was so helpless. She behaved like a helpless person. Can I? And I was just like, you know when you just hear brokenness? She just seemed to me so broken because she was like, oh, I don't know if it's okay. Can I call my husband? I was like, it made me so sad because I was just like, it's gone to that point where you don't even feel like you should be where you should be. You know, black people don't feel like you should have what you should have. So by the time you're in positions where you think it's high, you downplay yourself, or doctors come in and you're like, okay, whatever's best, whatever's best. More times, these are people, we including me, all I've done is read books and studied. But at no point did I ever study the body of Ayola. So you know more than me in certain places. You know, sometimes I might check you now, I might vaginally examine you, and you're 2 centimeters, and in 30 minutes you tell me you feel like you need to push. My book tells me that you're only 2 centimeters, but you could be 10.
Exactly.
You could be 10. So I feel like if I could give one message from this interview is that Black women, you do not have the luxury at this moment to come into it clueless. You need to study your body, you need to look, find out about things, find out about labour, find out about analgesia, find out these things because you don't have the luxury of doing that. Of getting the best care at all times. You don't know.
Yeah.
So
that's amazing. It's funny because I was just about to ask you that question, but you went into it. And especially for first mums, because they don't necessarily know where to look. I do think a lot of the times, you know, we kind of just go to our classes and just take the knowledge we're given and leave it as that. Do you know what I mean? We don't necessarily go the extra mile to find out actually what else is there. If I'm knowledgeable, I can then at least have a conversation with you. If I'm not, whatever you tell me, I'm going to say yes, because I'm in a position where I'm vulnerable. You know more than I do. So I think that was really key. It was absolutely lovely having you here today. You've obviously given tips of where to find some information. Would you just say YouTube or
NHS website, please, is the best one because that one I can claim that they call me. It's evidence-based care. Please don't check Wikipedia. Don't check all the other like random blogs. Like, don't get me wrong, women will always put their experiences, but sometimes women put experiences that they've had and they put it out like facts. You know, your body's different. Even your mum would have had a different labour to you, and she's your mum. Let alone Sylvia from YouTube. So NHS, nice guidelines, things like that is good.
Perfect. So thank you so much, everyone. I hope you've enjoyed having Elizabeth on the show today. She's given us so many nuggets, so much insights. If you have any more questions, feel free to send it in to us. But that's it today from Mums and Melanin.
Bye.
That was amazing.